Fake versions of Avastin may have made their way to hospital and pharmacy shelves without the key ingredient that treats the cancer. So there's the chance some people are taking Avastin right now to prolong their lives, but Avastin will have no effect because it's the fake one. Now keep in mind, the company behind Avastin sold 5 million vials of the stuff last year in the United States to help patients treat colon, lung, and kidney cancers, among others. Here's a look at the real drug. That's the vial on the left. That's the real one. The fake is on the right, so the labeling isn't even the same. Trace Gallagher in our West Coast News Hub. How much do we know about this fake drug, and do we know how much of it is in the United States?
They don't know how much yet. That's what authorities are now trying to figure out. They have so far sent 19 different letters to these medical practices in the United States. These are practices that are known to buy some of their cancer drugs from foreign sources, but there could be a lot more of these agencies. We know the phony Avastin has been in the United States since at least December, and that's very critical because it could mean that some cancer patients are now on their 3rd or 4th month of treatment with ineffective drugs. Here's Dr. Manny Alvarez.
You're taking a chemical that doesn't work. You're taking a chemical that has inner ingredients that can give you significant side effects. But the hallmark of this crime, which basically this is what it is, this is a major crime, is that you're killing the patient by not having a treatment that is effective.
Avastin, of course, is the same drug that the FDA pulled its approval for use in breast cancer last year that caused a firestorm of controversy, Shep.
We're hearing more and more of this, Trace. It feels like fake drugs are a real growing problem.
And even the FDA acknowledges the problem is getting worse. They just don't know how widespread it is. I mean, the head of the FDA has said that 40% of all the drugs we use in this country come from foreign sources, and that 80% of the active ingredients in the drugs come from overseas, which is a huge margin, or at least a huge market for fraud. Listen.
When you take a fake antibiotic, when you take a fake antidepressant, when you take a fake blood control, high blood pressure pill, or in this case, a chemotherapy agent, you're basically have the potential of dying, not even having side effects, of dying.
You talk about the market of drugs. Avastin alone last year in the United States, Shep, $2.5 billion in sales.
Wow. Trace Gallagher in L.A. Trace, thanks. Former Army Sergeant